It's been unique in a sense that I've never been through a process like this, so innovative and allowing the community to participate in the vision of the future for the hospital. So that was particularly unique and I really enjoyed it.
What I found was how important it was not just for us to learn what goes on in this hospital, but also how important what we were doing would be to contribute towards the hospital's future.
What I've learned is more about the services. I've learned staff experience, patient experience.
I'm taking away from this experience a great sense of hope for this community and what St. Joe's their vision is for the future of this hospital, and it makes me feel good to be part of that vision that they have and to have just been a little voice in that.
But even though we were 36 members in this panel, I feel that all of them in fact share some of the same feelings I share. They would like to know a little more about some of the things I'd like to know a little more about, and we found out through this panel. So most definitely brings me closer to the community and the hospital as well.
A sense of achievement, a sense of giving something back, a sense of forming or inputting rather a informed decision of healthcare to 2020 and shaping the services in the way that St. Joseph's is going to move forward. And the fact of being able to just sit back and think to myself in 3 or 4 years' time, I played a part of that and I gave input into something that is going to benefit a wider community.
There were two aha moments, I think, for me. One is the resounding message that nobody really knew what St. Joe's is actually doing over here and how well they do it. That was a big aha moment because I personally did not know what St. Joe's did over here. But the second one is, I think, the mental health facilities that St. Joe's has here. I personally got the tour of the mental health facility, and just understanding how important the mental health facility was in this community, especially with the demographic in the community. It was heartbreaking, to tell you the truth. And it really spoke to the importance of what St. Joseph means to this community.
If you're not involving those who you're taking care of, how can you make it better for them? And I feel that this specifically to me, because I care for the community around me, it's been a benefit. So.
The strategic initiatives that we're trying to put together, we've done a lot of work within the health center, but we've also presented some of that work to the panelists, and they've taken the information that they've put together and kind of given us feedback as well on our initiatives that we're shaping, our drafts, if you will. And it's really, the information that they've given us is really going to help us and has been helping us shape the ideas that we're going to ultimately put on paper and present to the community in the coming weeks and the coming months. Beyond that, one of the things that we heard from the panel, or the panelists, was that they would like to be involved going forward beyond that, to see how this to see where this document leads us a year, 3 years, 5 years from now. And it's great that we've put together this panel, and they can serve as sort of a measure of how our strategic initiatives play out as we move forward towards 2020. Seeing all these people that don't work here and have the panelists I'm talking about who have just such an interest, such a passion in what we do here and how we do it, it's invigorating, certainly for people like myself who work here. It really makes you feel like you're doing something worthwhile.